tell us from your review of the medical records after the motor vehicle accident, beginning with the EMS, was there any knee complaints given to the emergency medical personnel at the scene of the accident who transported him to the hospital?
At the scene of the accident, there were no knee complaints to the emergency personnel.
And what about the next encounter at the St. Mary's ER? Was there any record of any knee complaints to the St. Mary's personnel?
There were no complaints to the knee to anybody at St. Mary's Hospital emergency room personnel, including triage, nurses, or the physician.
And they would examine the extremities there, and there was nothing in the extremity evaluation that tipped off anybody there that the gentleman was complaining about any knee injury.
Correct. There was no knee findings on the extremity examination in the ER.
Was there any crutches given when he departed the ER?
There were no crutches provided when he left the ER.
Did they x-ray the knee at the ER?
No x-rays were taken of the knee in the ER.
Was there any diagnosis with respect to the knee at the ER?
No diagnosis was made, as there were no complaints or findings.
Now, that statement about a sprain 3 to 6 weeks, if you tear your ACL, it takes much longer than 3 to 6 weeks to resolve, right?
Correct.
We're talking about a rupture. That 3 to 6 weeks, you're talking about a minor sprain. Is that correct?
Correct.
Now, the next physician he saw was Dr. Talmore. You reviewed those records.
Yes, I did.
Was there any knee complaints in Dr. Talmore's records?
There were no knee complaints or findings in the records of Dr. Talmore.
All right. And did you see in Dr. Talmore's records, the patient himself had wrote it down, a history or a symptom that he felt after the accident? What did the patient write in terms of what his symptom was?
He wrote lower back pain and lower stomach pain.
And what did he check off as the symptoms as a result of the accident?
Difficulty sleeping and
Low back pain.
And one further one?
and stomach upset.
Was there any spots checked for any leg or any other thing?
He did not check off any, did not write down or check off any leg pain.
Now, you saw Dr. Talmore did a neurological examination.
Yes.
And as part of that neurological examination, does he inspect the leg?
Part of the normal neurological examination, you do reflex sensory motor checking for leg pain and for part of the back examination.
And the strength of the extremity?
You check the various muscle strengths.
And why does the muscle strength help you determine if there's a back situation?
If you have a back injury involving a nerve root, then that muscle is affected and you get weakness of that particular muscle.
All right, and you also are checking the nerve. Tell us, I think you mentioned earlier about the knee test. Tell us about the patellar reflex test.
In this case, Dr. Talmore checked the knee reflexes and they were normal.
So tell the jury, do you have a hammer with you by any chance?
I did not bring the hammer because of...
So what does the hammer do? How do you do the knee? I mean, if someone is hammering on your knee, sitting there, trying to see if your knee comes out, and expect the patient to say, ouch, my knee might hurt from other things?
Objection, Your Honor.
Grounds.
Speculative.
Overruled.
The knee examination is routinely done. The patient is sitting. You ask them to relax. Sometimes you ask them to bite down on their teeth or pull their hands apart for reinforcement. But what you do is you take the hammer, you stand to the side, take the hammer and hit with the tip of it the patellar tendon, and you observe the knee reflex kicking out.
And there's nothing in these records that reflect the patient tells Dr. Talmore at any time while he's checking, hitting the knee below the kneecap or anywhere that he has some issue going on with his right knee.
Objection, Your Honor. It's leading.
I'll rephrase the question.
Sustained.
Is there any evidence in Dr. Talmore's records of any knee complaint at any time during the examination or otherwise?
There were no knee complaints or findings during the course of Dr. Talmore's examination. As documented.
Is this consistent or inconsistent with an alleged acute tear of the ACL and the accident happened on April 18, 2019?
You would have expected with an acute tear of ACL, the knee to be discolored, swollen, tender, and there was no findings documented by Dr. Talmore of any swelling, limp, dysfunction of the knee. And patients often object to getting their knee hit with a reflex hammer if they have an acute, swollen, painful knee.